When life is busy, it's great knowing that you've got healthy, research-based foods that are good for you, but are also convenient.
This is Dr. Elizabeth Klodas. I'm a cardiologist and founder of Step One Foods, and I am thrilled today to have a heart-to-heart conversation with some customers of Step One. And we have 3 people with us today who have used Step One Foods and have results to share and experiences to share.
So my name is Jill Horseman, and I live in Alaska. I have been using the product off and on for a couple of years, but consistently over about a 2-month time frame.
My name is Dana Fisher, and Janet and I have been using Step One products for several years.
How did you decide to use it? What problem were you trying to solve?
I have a background in my family of heart disease and heart attacks, and I was having heart problems and high blood pressure, and getting on Step One changed all that. Everything dropped. Went in for a doctor for a checkup, an annual checkup, and my doctor was just, dropped her jaw in surprise after listening to my heart and taking my blood pressure about the incredible improvement I had made.
Jill, tell me about how you found us and what your health goals were when you started on Step One.
Well, I had been on statins, the lowest dose, when we were still living in British Columbia. And when we moved up here to Alaska in 2012, I had gone off, and we were thinking I probably had just bumped it down enough to where I was okay. So when I saw the advertisement for Step One Foods, that was the first thing I looked for is, well, this sounds great, but it's probably has gluten. So that was a bonus. There's not that much prepared products that are healthy and gluten-free. I really like how convenient it is.
It's a constant, so it provides structure and reliability in what we're doing and what we're consuming and what we're eating, and that it's real food.
Mm-hmm.
So it's really interesting. I mean, both of you have tried to minimize your statin use, right? Dana obviously has avoided it altogether. You've tried to lower your dose, and that's one of the places where we find that our foods really fit in well, right? Is allowing people to really reduce the amount of medication required to control their numbers.
Both of us had cholesterol that had dropped 30, 35 plus points.
I could say 2 simple things. One is how dramatically my health did improve, and how, given my family history and my lifelong issues, how those issues are resolved. That's just amazing. The other thing that I could say, this might sound funny, but that surprises me, is how much I continue to enjoy eating Step One Foods every day, period. I never not look forward to it.
You have no idea how many days you've structured, how many people's lives you've structured around the morning coffee break and chocolate.
What would you say is your favorite part about using Step One Foods to, in order to attain your health goals?
I think it's knowing that there's a product that is safe to eat. It's research-based. Research matters. And so that's actually what drew me to Step One Foods. So it's something that I can purchase and I can enjoy, and it's easy. And so that's when life is busy, it's great knowing that you've got healthy, research-based foods that are good for you, but are also convenient and affordable. And so all of that is really, it's great. It's important and it's helpful. I wish there had been something like this for my dad. My husband and I both work full-time. I'm doing another master's degree, so we're really busy. So it's great having, especially the bars.
I know its basis in research, and like I said, it provides a real structure that is consistent